It's Medicosis Perfectionalis, where medicine makes perfect sense. Let's continue our biochemistry playlist. In the previous video, we have talked about vitamin C. Today, it's time for vitamin K. It is a fat-soluble vitamin. You need vitamin K in order for your blood to coagulate. With that said, now let's get started. But first, let's answer the questions of the previous video. Ancient Egypt, they used to feed their patients organ meat, such as liver, in order to treat an ophthalmological condition. What's that condition? This is vitamin A deficiency, known as nyctalopia, night blindness. And that's why you eat liver, because the liver stores vitamin A, because vitamin A is a fat-soluble vitamin that can be stored for a long time. Next, the sailors of the British Navy and the Spanish Navy used to develop a bleeding diathesis. What's this? This is vitamin C deficiency, known as scurvy. And last, we have the story of the Japanese Navy sailors who ate only white rice, and they developed a problem, nerve problem, heart problem. What is this? This is beriberi, or vitamin B1 deficiency. In Japan, beriberi is known as kake. This is my biochemistry playlist. We have talked about all of these vitamins before. Vitamin K is today's video. Next videos we'll talk about vitamin E, vitamin D, and vitamin A. I'll give you 3 patients and please let me know what is common among them. Patient number 1 developed a bleeding disorder, bleeding from everywhere and especially deep tissue bleeding, bleeding into joints, bleeding into the brain, internal bleeding, late rebleeding, etc. Patient number 2 had bone fractures, and patient number 3 had soft tissue calcifications, especially vessel calcifications. What all these 3 people had in common is vitamin K deficiency. Now, let me give you a disclaimer. Clinically speaking, you can attribute bleeding, especially deep tissue bleeding, to vitamin K deficiency. But it's very hard to attribute bone fracture or vascular calcification to vitamin K deficiency. In other words, just because a patient had bone fractures and vitamin K deficiency doesn't necessarily mean that the bone fracture is caused by the vitamin K deficiency. And this is true for the bone fracture and for the soft tissue calcification. However, for the deep tissue bleeding, you can attribute this to vitamin K deficiency. It is clear. In today's lecture, we'll talk about vitamins. We'll talk about vitamin K, its chemistry, sources, metabolism, deficiency, and excess. As you know, vitamins are organic molecules. They are micronutrients. They are essential, which means your body cannot make them. Therefore, you have to eat them in the diet. But hey, Medicosis, my gut bacteria can make vitamin K. Yes, that's true, but notice you have said your gut bacteria, not your own body. That's the bacteria. That's a different organism that's making the vitamin K for you. We divide vitamins into water-soluble vitamins and fat-soluble vitamins. Vitamin K, which is today's topic, is a fat-soluble vitamin. Translation: deficiency is less likely. However, toxicity is more likely. Why? Because it's fat-soluble, that's why it is stored in fat and in your liver. And since vitamin K is a fat-soluble vitamin, therefore its absorption is gonna depend on a robust gastrointestinal tract, a competent liver, and a doozy pancreas. Any problem in any of these 3 can lead to vitamin K deficiency. Moreover, let's say I have malabsorption syndrome. Oh, I'm gonna have a problem absorbing my fat-soluble vitamins, including my vitamin K. Here are your water-soluble vitamins, and here are your fat-soluble vitamins. If you look here, where is vitamin K? Vitamin K is here, baby. And as you see, this is 17% of your daily requirement. But hey, Medicosis, don't you think that 17% is too low? Calm your butt down. You have bacteria in your own gut right now, and they are making vitamin K for you. Some biochemistry tips. Vitamin B1 is responsible for decarboxylation by dehydrogenase enzyme. B2, redox, which is reduction oxidation. B3, redox reactions. B5 is for anything that has coenzyme A. Vitamin B6 is for transamination by the transaminases. Please don't forget your liver enzymes, ALT and AST. The old names are SGOT and SGPT. Vitamin B7 is for carboxylation, which is playing with a CO2. Folate is for transfer of 1 carbon units and for DNA synthesis. B12 is for isomerases, mutases, and DNA synthesis. Vitamin C is for hydroxylases, which is playing with an OH group. Vitamin K is similar to vitamin B7, carboxylation again, and carboxylation usually involves adding a carbon dioxide. How about decarboxylation, removing a carbon dioxide? Some synonyms. Vitamin K is synonymous with anything that ends in quinones. Example, phylloquinone, menaquinone, farnoquinone, nephloquinone. Who named these things? And here is a tip for doctors. Again, doctors, not freaking chemists. What's the difference between quinones and quinines or quinine? Okay, quinones is vitamin K. Quinine is the malaria drug, such as hydroxychloroquine, mefloquine, chloroquine, etc. So there is a huge difference between quinones and quinines. Health-related books are the only books that can kill you just because of a typo. We have 3 subtypes of vitamin K. We have vitamin K1, we have vitamin K2, and we have vitamin K3. K1 and K2 are natural, and they are fat-soluble. That's the natural vitamin K. Vitamin K3 is synthetic, and it's water-soluble. It's more potent, yeah, because I can give it to you intravenously, but don't forget it's water-soluble. It's not going to be stored in your body for long. However, since it's water-soluble, it's very easy for your kidney to excrete. And that's why I do not understand why parents are worried when we give their neonates vitamin K after delivery. It's water-soluble, my friend. Like worst case scenario that we gave too much vitamin K, the baby's kidney is gonna get rid of the vitamin K and everything in the hunky-dory. On the bright side, this can prevent a bleeding diathesis in the neonates because the neonate's gut is sterile. It doesn't have bacteria yet. He hasn't been living in our dirty world for long. So we just give vitamin K and then the bacteria will kick in and the bacteria will make his vitamin K for life. So calm down. If the doctors are trying to give your kid freaking adalimumab, yes, you should be worried. But vitamin K is as safe as it gets. Where do I get vitamin K1 from? From your green leafy vegetables. How about K2? The bacteria in your gut can make it for you. Any fermented substance can give you some vitamin K2, and liver organ mate can give you vitamin K2. K3 is synthetic. This is the pills or the injections. Vitamin K absorption and metabolism. So you eat your green leafy vegetables and make your mama happy. And green leafy vegetables and vitamin K is going to be absorbed from the small intestine. Moreover, bacteria in your gut are going to make some vitamin K for you. Okay, vitamin K is now being absorbed. For vitamin K to be absorbed, since it's a fat-soluble vitamin, it needs 3 things. A good liver and biliary system, a robust pancreas, and a competent gastrointestinal tract. Okay, now vitamin K has been absorbed into the portal circulation. It's going to go to the liver. Some of it's going to be stored in the liver, and some of it's going to reach the blood. Vitamin K has 3 main functions in life. Number 1 happens in the liver. Gamma-carboxylation of the prothrombin group. And these are your coagulation factors. Factor 2, 7, 9, and 10. 2, 7, 9, 10. If you remember your cranial autonomic nerves, they were 3, 7, 9, and 10. Not 2, 7, 9, 10. Okay, so this is prothrombin, 7, 9, 10. Moreover, there is protein C, protein S, and protein Z. These are procoagulants. These are anticoagulants. And this was the first function. The second function is to make your bone robust. It helps with bone mineralization. Function number 3, to prevent soft tissue calcification. As you know, your diet usually consists of carbohydrate, fat, and protein. Let's talk metabolism. Carbohydrate, polysaccharides, monosaccharides, and then proteins, polypeptides, amino acids, and then fats, triglycerides, which will give you glycerols and free fatty acids. The most important digestive enzymes come from the pancreas. The pancreas alone can complete the digestive process from start to finish. Okay, medicals, what kind of fat would I find in my gut? You would find some triglycerides, some cholesterol, essential fatty acids, and fat-soluble vitamins. And here are these 4 molecules. Let's say that I have a malabsorption syndrome. I will not be able to absorb triglycerides, cholesterol, cholesterol, essential fatty acid, or lipid-soluble vitamins, including vitamin K. That's why I can develop vitamin K deficiency. Hey medicosis, can I absorb triglycerides? Not until you break them down, because triglycerides are too big. Okay, how do I break them down? The pancreas is going to give you some lipase, which will break down triglycerides into glycerols and free fatty acid. So the pancreas will secrete lipase and colipase for digestion of fats, protease for digestion of protein, amylase for digestion of carbohydrate. The pancreas is awesome. Okay, the pancreas, when it comes to lipid, is going to secrete lipase, colipase, cholesterol esterase, and phospholipase. Okay, let's digest those dietary lipids into some teeny tiny molecules. And then let's lump them together with fat-soluble vitamins, vitamin K, E, D, and A, and this is called emulsification. And then let's absorb this beautiful greasy mixture. Who's gonna help us? Bile salts. Where do they come from? From the gallbladder. And who made them? The liver. And that's why to absorb vitamin K and other fat-soluble vitamins, you need your pancreas, you need your liver, and of course, you need your intestine. Because absorption happens in the intestine. No duh. Sources of vitamin K, we have natural and we have artificial. Let's start with natural. We have food and we have bacteria. What kind of bacteria? Your normal flora of your gut. This is present in every single human being with two exceptions. Number one, if you are a neonate who has just been born. In this case, your gut is sterile, no bacteria yet. Exception number two, if you have been taking broad-spectrum antibiotics for a very long period of time, to the point that you have eliminated your gut bacteria. But why would the freaking doctor give me broad-spectrum antibiotics for a long period of time? Maybe you're immunodeficient and you are at risk of opportunistic infections. There are no solutions in life. There are only trade-offs. Food sources, green leafy vegetables, especially spinach, lettuce, broccoli, and much more. Artificial sources of vitamin K, including supplements, and we have pills, we have injections. My dear parent, the decision is yours, but I strongly recommend that your baby gets vitamin K. Bacteria can make vitamin K, but human beings cannot. Functions of vitamin K. Carboxylation, baby. Gamma-carboxylation of the coagulation factors, the prothrombin group, factors 2, 7, 9, 10, protein C, protein S, protein Z. Carboxylation of glutamate residues of calcium-binding proteins, including in the bones, and oxidative phosphorylation and other cellular functions, especially in your freaking mitochondria. Benefits of vitamin K, we have direct benefits, this is clinical uses, or indirect benefits, this is biochemistry stuff. Let's start with the clinical. We can use vitamin K to treat bleeding diatheses caused by vitamin K. No kidding. Vitamin K will boost bone calcification, but it will prevent soft tissue calcification. Both of these results are doozy. Vitamin K is a cofactor for carboxylation and oxidative phosphorylation. Let's review some basic molecular biology. Of course, you know that when we go from DNA to another DNA, this is called DNA replication. When we go from DNA to RNA, it's called transcription. If you want to go back, reverse transcription. The reverse transcriptase enzyme is not present in humans. It's present in HIV virus, for example. If you want to go from RNA to proteins, this is called translation. After you make some proteins, you need to modify these proteins, trim them, add stuff, remove stuff like that. These tweaks and adjustments and tune-ups are known as post-translational modifications. Love it. If you remember my previous video on vitamin C, we have talked about collagen modification. This is an example of post-translational modification. Another example of post-translational modification is the gamma-carboxylation. You can thank your vitamin K. Please note that when you eat your doozy green leafy vegetables, they provide you with the active form of vitamin K known as reduced vitamin K, or vitamin K bound to a hydrogen, because this is called reduction or a reduced form. When it's bound to oxygen, this is called oxidized or inactive form. After you absorb your vitamin K in the reduced form, it's gonna be converted into the oxidized or inactive form. Oops, who's gonna help me? A great enzyme in your liver known as epoxide reductase. It's gonna convert the oxidized inactive vitamin K into the reduced active vitamin K. And this is your doozy enzyme known as epoxide reductase. You can call it epoxide reductase or vitamin K dependent epoxide reductase or VKEOR. See who named these things. And then you wonder why chemistry professors are miserable. Okay, medicosis, we got you. The doozy enzyme is gonna convert vitamin K from the inactive form into the active form. Awesome. Now, what's the function of the active form? Gamma-carboxylation, baby. Of what? Of glutamic acid proteins. Such as what? Such as your coagulation factors. Factor 2, 7, 9, 10, protein C, protein S, and protein Z. And it's gonna carboxylate them, which means add a carbon dioxide, and then convert them from glue means glutamic acid, into GLA. GLA means gamma-carboxyglutamic acid. This is glutamic acid after carboxylation at the gamma carbon. Look at this. Here is the gamma carbon before carboxylation. But look, after carboxylation, we have added CO2 because COO happens to equal CO2 if you happen to go to school. And now what's the function of these gamma-carboxylated glutamic acid proteins? Oh, they are active. So you're trying to say that now my coagulation factors are active? That's true. And therefore they can bind calcium and cause blood coagulation? Absolutely right. And that's why if you have vitamin K deficiency or if you're taking warfarin that inhibits the epoxide reductase, either way, you're gonna end up with failure to coagulate your blood and you're gonna bleed. Don't forget that vitamin deficiency in general can lead to cell injury, chromosomal breaks, DNA breaks, and this can increase your risk of cancer and it can decrease longevity. So if you have mild vitamin deficiency or moderate vitamin deficiency, on the short term, nothing will happen. On the long term, bad things can happen. One of the best habits that you can develop is to take a daily multivitamin. It is cheap but super effective. Vitamin K has 3 functions in life. Number 1, it can help blood coagulation. Number 2, it can help with bone mineralization. Number 3, it can prevent soft tissue calcification. First, vitamin K and blood coagulation. I've talked about this before in a video called Vitamin K Deficiency in my bleeding and coagulation playlist. So we'll do this very quickly. Hemostasis has many steps. Vitamin K will help you with step number 3, the coagulation or the secondary hemostasis. Hey medicosis, how do I test that I have robust secondary hemostasis or blood coagulation? It's called PT, PTT, and TT. Vitamin K is gonna help activate factor 2, factor 7, factor 9, and factor 10. Let's talk about vitamin K deficiency. Vitamin deficiency in general is when we have decreased level of that vitamin in your blood and therefore decrease the level of the same vitamin in your urine. We have 2 types, primary deficiency and secondary deficiency. Primary deficiency, decrease intake. Secondary deficiency, normal intake, however, you are not absorbing the vitamin. If I have vitamin K deficiency, I will suffer from a secondary hemostasis defect. You can test for this in the lab using the PT, PTT, and TT tests, and I will suffer from deep tissue bleeding or anatomical bleeding, such as hemarthrosis, muscle hematomas, brain hemorrhage, lateral bleeding, bleeding after tooth extraction, internal bleeding, etc. The superficial bleeding can happen, but it's rare. When it comes to vitamin K deficiency, expect deep tissue bleeding. What can cause vitamin K deficiency? A problem in your diet, a problem with your gut bacteria, a problem with your absorption, or problem in your liver, or maybe you're taking a medication. Problem with your diet like what? If you're not eating enough green leafy vegetables, and more importantly, if you are taking too much vitamin A or vitamin E, they will inhibit and interfere with vitamin K. Next, sterility. If you have no bacteria in your gut, example, newborns, they have just been born, not exposed to the dirty world of ours yet, or long-term broad-spectrum antibiotics use, especially cephalosporins and sulfa drugs. Absorption problem. Blame your gut, blame your liver and biliary system, blame your pancreas. Let's blame the gut. Celiac disease, inflammatory bowel disease such as Crohn's or ulcerative colitis, short bowel syndrome, usually after surgery. Let's blame the liver and biliary system. Biliary atresia, primary biliary cholangitis, primary sclerosing cholangitis, familial intrahepatic cholestasis. Let's blame the pancreas, cystic fibrosis. Oh, by the way, people think that we called it cystic fibrosis because there is fibrosis in the lung and cysts in the lung. That's not true. The lung has an obstructive lung disease, not a restrictive lung disease. Therefore, no fibrosis and no cysts. The cysts and the fibrosis are in the pancreas. That's why we call it cystic fibrosis. Chronic pancreatitis or pancreatic insufficiency. Add a beta-lipoproteinemia here, that's a fat malabsorption. And all of these can lead to vitamin K deficiency. Liver failure can lead to vitamin K deficiency. Warfarin inhibits the epoxide reductase, keeping vitamin K in the inactive form. When the baby is born, the baby has no bacteria in its gut. However, when the baby is exposed to our dirty world, the baby will get bacteria in his or her gut. And this includes breastfeeding because mommy's breast is not 100% clean. But hey, Medicosis, as a mother, I'm so offended by what you said. I shower 3 times a day. Even if you shower 17 times a day, you still have bacteria on your skin. Please don't take it personally. Take my fingertips, for example. The number of bacteria on my fingertips is so huge it's gonna make your head spin. The tip of the bottle has bacteria in it, so the baby will be exposed to bacteria no matter what you do. Oh, and that's a good thing, by the way. Okay, Medicosis, does mommy's breast milk have vitamin K? The answer is no. Mommy's breast milk is awesome, but it's deficient in 3 things. The mnemonic is FIDIC. Fe is iron, D is vitamin D, and K is vitamin K. So the baby gets vitamin K not from the breast milk, it's from the breast skin itself, and from the bottle, and from putting his fingers in his mouth, etc. Here is a history question for you. Why did Jewish people circumcise their male newborns on the 8th day? Why not the 3rd day? Why not the 4th day or the 5th day? From a medical standpoint, the 8th day allows enough time for the baby to develop some gut bacteria to make vitamin K. Before this, there is an increased risk of bleeding. But hey, Medicosis, what if I want to circumcise my boy, but I don't want to wait for the 8th day? Then let's give the baby vitamin K shot after birth. And this will decrease the risk of severe bleeding tremendously. Vitamin K has 3 functions. Number 1, carboxylation of the coagulation factor. Number 2, carboxylation or activation of osteocalcin, which increases bone mineralization. Number 3, increase MGP. What the flip is this? Matrix GLA, which is the glutamic acid residue proteins, and this will prevent calcification of soft tissue, specifically vessel calcification. And therefore, if I have vitamin K deficiency, I might suffer from bleeding, bone problems such as fracture, and soft tissue calcification, especially vessel calcification, VBC. We have talked about vitamin K deficiency before. Please watch my video in the bleeding and coagulation playlist. This is how you diagnose it, and this is how you treat it. And of course, you prevent the hemorrhagic disease of the newborn by giving intramuscular vitamin K. In vitamin K deficiency, platelet count is normal, bleeding time is normal because primary hemostasis is normal. However, PT and PTT are prolonged because secondary hemostasis is screwed. How about hypervitaminosis K? It is very rare. Symptoms might include hemolytic anemia with or without jaundice. What is the daily requirement of vitamin K? It's about 100 micrograms per day. Let me leave you with 2 questions. Question number 1. You have 2 patients with vitamin K deficiency. The first patient had parenchymal liver disease. The second patient had malabsorption syndrome. How can you tell the difference as a hematologist or a lab scientist? I said hematologist because I do not want you to say liver biopsy. I want you to think cheaper than this. Antibiotics can lead to vitamin K deficiency, especially if they are long-term broad-spectrum antibiotics, especially cephalosporins, particularly the 2nd and 3rd generation cephalosporins. Sulfa drugs can lead to the same. When cattle eat spoiled sweet clover hay, they can develop vitamin K deficiency and bleed. Don't forget, rat poison is warfarin. The second question is, why do we use vitamin C to treat methemoglobinemia? Let me know the answer in the comment section. You'll find the answers to these questions in the next video. I have more than 800 free videos on YouTube, or if you want my premium courses, go to my website medicosisperfectionalis.com. I have a cardiac pharmacology course with 50 videos and an antibiotics course with 40 videos. and you can get a 40% discount towards anything on my website. Just use discount code 40OFF. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my premium courses. This is Medicosis Perfectionalis, where medicine makes perfect sense. Until next time, be safe, stay happy, and study hard. And now I'm gonna go eat some green leafy vegetables.